exactly. We have feedback, questions?
So, but I mean, you're advocating though to wait on implementation, despite all the stimulus money, despite no, okay.
There's certain things you can do, but there's the point is that there's still a lot out there that has yet to be explained. There's most of the rules that are out there, as you know, are interim final rules, which means there's a lot of comment that has to come in. That has to be considered. The final rules have to eventually roll out. There's certain things that you should be organizations can be doing now, should be doing now. There's certain pieces of it that we already know that we should be applying, and we should be doing those. But in terms where it comes to systems, I mean, some of the problems that we have, or some of the challenges that we have with high tech in terms of certification, is quite frankly a vendor issue, right? So obviously, one of the things we could be doing today is looking at whatever system we're using and looking to see if it has any of the attributes that are already listed in the certification criteria, right? Because we already know that those are things that the government is looking for before that system is going to be certified. If we're using a system today that doesn't have those attributes, doesn't have that functionality, then one of two things is going to happen. We're either going to have to go back to our vendor or have our vendor provide an updated version of it at some point that does provide that functionality, or potentially look at another system, which I don't think anybody's excited about doing in a lot of cases, or find some alternative way of meeting that requirement with whatever we're doing that can still meet certification. So the certification process has not come out yet, right? And and my point is that I just see that there's still a lot of many of the pieces of this that just haven't been defined all the way. There's certain things that we should be doing already, and quite frankly, I think most docs in America are doing. Like for instance, when they talk about employing minimal necessary. Right? That's a pretty simple concept, right? If I don't need the information, or somebody doesn't need the information to perform his or her function in the mission of care, they shouldn't have access to the data. Already, I should be figuring out how to do that, right? Regardless of whether my system will eventually allow me to apply what's called limited data set, which is a technical way of limiting somebody's access to information, right? So those are things we could already be doing. My business associate agreements, if I'm actually using a third party to provide support to me and they're handling protected health information, I should have by now already updated my business associate agreements to at least incorporate those pieces that have already been spelled out, right? And one of the things that I should be already looking at is the whole breach notification piece, right? Because that's already been explained to me, and there's a business associate component to that, and that whole notification regime.
Why don't you? I think the readers, some of them who don't know about the breach notification, would be really interested to hear just what those breach notification penalties really are.
Well,
Public disclosure.
oh yeah, and in fact, we've already seen that, right? I mean, the federal government said that after February the 23rd, they would begin to publish the folks that have notified a breach of more than 500 records. And in fact, on February the 24th, they published the first 33 offenders. That it did include not just hospitals, but it included several physician groups. So yeah, if you have a breach today that involves more than 500 records, you have a responsibility to report to HHS, to the local media, to your state level folks, as well as to all of the individuals who could potentially have been affected by that breach. And HHS will within 24 hours post you on their website for all the world to see, as well as what the particulars were around the incident, and then you have potentially the responsibility to obviously investigate the incident and determine what happened and deal with it after that. Now there's a couple of safe harbors here that people should understand, and that is, first of all, if the data was on a properly encrypted device. In other words, if it was a laptop that was lost and it was encrypted with a proper encryption strategy, or if it was a thumb drive that was encrypted, or a backup tape that was encrypted that was lost in some manner, or a desktop or whatever, then you don't have a responsibility to report, because you've done what was necessary or what was reasonable to protect that information. And there's in the standard in the rule with respect to breach notification actually explains in detail the level of encryption that has to be applied there. In addition to that, the HHS has also put a harm provision, excuse me, in their rule as well, which says that the organization can do a risk assessment of the incident to determine whether or not there was potential for significant financial or reputational harm to the individuals involved in the incident, and if there was not, or if the determination is that there would not have been, then again, it's not necessary to report that. But it is necessary to document that risk assessment, document those findings and the rationale for why, and to understand that you still are going to have to report that at the end of the year in your annual report, right? So we have two reporting requirements under the breach rule. One is immediate if it involves more than 500 records. One is annual if it's less than 500 records, right? So every year at the end of the year, within 60 days of December the 31st of each successive year, we have to provide a record of all breaches that occurred throughout the year, regardless of what size they were. So just because we don't have a big one doesn't mean we still don't have to keep track of it and deal with it and report it.
Other,
one of our followers here is asking about. It's kind of a question I hear a lot of times. Why is it that medical record security is never quite up to snuff, or there's always competing plans and concerns, whereas financial security seems to have been sorted out a long time ago, and we just don't hear that much about it?
Well, first of all, I wouldn't say that the financial side is completely sorted out, but part of it is that the financial community has had 20 years jump start on you, right? So there's some fundamental cultural differences there between the two industries, but the technical problems and the requirements and whatnot are really not that very different, because whether data at the end of the day is an electronic element, right? So it doesn't matter whether I'm talking about a classified piece of material or in the government sense, or whether it's a financial issue from a financial sector or a health record piece of information. It's still electrons flying across the wire through systems. So the controls, access controls, etc., are still very similar. But the differences are the cultures and the requirement and how hard they're being pushed by the general public. And on the financial side, they really got pushed hard by the general public to go electronic quickly for convenience reasons, and then the public learned how insecure that is if it's not done correctly, and you had a double whiplash where the public said, "Oh, by the way, I want my information protected. I don't want somebody to be able to commit identity fraud or to get a hold of my transactions or my bank account, etc." And I think if you just think about your own experiences from that time period till today, and your relationship with your bank and how that's changed and how those systems have changed, etc., it makes a lot of sense.
Wow, a fascinating discussion. I wish we had more time. And for people who are watching who are not on site here, where can they find some more information on the internet? We're in Austin, Texas. That's where our main office is, although we have folks around the country. But you can catch us at www.cynergistek.com. Great. Matt McMillan, the chairman and CEO of Cynergistek. Great discussion about security. I know I learned a lot, so thanks a lot for the time here this afternoon.
I appreciate it. Thank you.
And Better Health's coverage live here at HIMSS 10, and we'll be continuing in a few minutes. We'll be right back.